Hello everyone, I'm back again. This video is going to discuss partner abuse, child sexual abuse, and sexual assault, and some of the outcomes that it can have on everyday life, and not just while it's happening, but further into the future as well. So, the fatal outcomes are listed as homicide, suicide, maternal mortality, and AIDS related. The non-fatal outcomes are listed as physical health, the injury, functional impairment, physical symptoms, poor subjective health, permanent disability, and severe obesity. Chronic conditions, chronic pain syndrome, irritable bowel syndrome, fibromyalgia, gastrointestinal disorders, somatic complaints. Mental health has PTSD, depression, anxiety, phobias, panic disorders, eating disorders, sexual dysfunction, low self-esteem, and substance abuse. Negative health behaviors include smoking, alcohol and drug abuse, sexual risk-taking, physical inactivity, and overeating. Reproductive health has unwanted pregnancies, STIs and HIV, gynecological disorders, unsafe abortions, pregnancy complications, miscarriage, low birth weight, pelvic inflammatory disease. Now, another list that I came across during the research has a few different things mentioned, and some of them are kind of fit into these other categories that I've just mentioned. But they were sexually transmitted infections, vaginal itching or bleeding, painful defecation or painful urination, sexual problems with lack of pleasure, vaginismus, which is the spasms of the muscles around the opening of the vagina, anxiety, depression, self-destructive behavior, sleeping problems, history of chronic unexplained physical symptoms, having difficulty with or avoiding pelvic exams, sexually acting out, and problems with alcohol or drugs. There are quite a few more. Each person is unique, therefore the overall symptoms will be unique to the individual. But this is just basically a really small list of things that can happen in the future when somebody has been a victim to any type of sexual abuse or partner abuse. It's a lot to comprehend. The list literally goes on and on and on because of everyone's uniqueness. You know, one way it affects one person may not affect the other in the same way. But you might have 5 or 6 people with the same thing or the same effect, but for different reasons. So just keep that in mind whenever you're talking to somebody that is dealing with domestic violence or has been in a situation, child abuse, sexual assault, either by stranger or by family, by partner. Keep in mind, what they're going through, because the stuff on this list isn't something that you can just always see, and it's not something that everybody just talks about. But when you come across a survivor know that there's other things going on.